Hey everybody, I'm Jeff Kaufman from CME Procedures. This is a quick tip production. We see a lot of elderly patients that have skin tears that come in, they bang their shin on something and their skin is so weak and thin it just rips open. Skin tears are very difficult to treat. Occasionally we can get stitches in them. If you can stitch a skin tear, I recommend doing at least a couple mattress stitches to take some pressure off that. If you just try to do an interrupted stitch or running stitch, you're probably just going to rip right through that tissue. However, another trick that I have learned is to use steri strips and put steri strips along the wound edges. So what we're going to do is actually take the steri strip and build up each edge. So you're going to put this parallel to the cut right on the edge, and then when you suture, you'll take your suture needle and go right through the steri strip, through the skin, through the tissue, back out the other side, through the skin, and then through the steri strip. This is going to add some strength to their skin, and it allows for a lot better healing, and that suture is not going to be as likely to rip through that tissue. So here's an example. This is just a patient's arm. We're going to draw a laceration on it and just show you how to build up that wall on each side. So we're going to assume this red line is a skin tear on an elderly patient, and you can't put stitches directly through these because you'll just tear their skin. So what we're going to do is line each side of the cut with steri strips. You can stack several of these on here. So we'll stack them on both sides of the cut. And we'll just assume that I put 4 or 5 on each side. So this is going to make this skin a lot thicker. And then when you go to suture, you actually put your needle through the steri strip, through the skin, come out on the other side. And that's going to give you a lot more support to pull this together so that the skin doesn't tear.